everyone, my name is Zhong Mei. I'm glad to share my interested project, potential roles of SELECTINS in periodontal diseases and associated systemic diseases. Could they be targets for immunotherapy? There are three parts: background, research progress, and discussion. As we know that periodontal diseases represent a global public health problem with a prevalence figure of up to 50% worldwide. Individuals with severe chronic periodontitis have been reported to have a significantly increased risk of developing cardiovascular diabetes and so on. There are many factors to promote periodontal diseases like chronic inflammatory diseases, unhealthy diet, high carbohydrate consumption, and so on. The primary etiologic factor of periodontitis is the inflammatory immune response induced by microbiome dysbiosis. Because of the dysbiotic microbiota, periodontal pathogens promote leukocytes to extravasate into circulatory system through the ulcerated and inflamed surface of the gingival pocket, and then cause periodontal tissue discussion, and finally lead to the tooth loss and increase the risk to systemic inflammatory. The SELECTINS are a big family of the adhesion molecules. They have the common ligand PSGL1. It also plays an important role in the progress of the inflammation. When endothelial cells suffer from the injury, they may cause the activation of SELECTINS. They can initiate the primary rolling of leukocytes. They are mainly located on the surface of the neutrophils, monocytes, platelets, T cells, and even though the endothelial cells. After introducing the background, the part 2, I will introduce the role of SELECTINS in periodontal diseases and associated systemic diseases. The first linkage is periodontitis and diabetes. There are three possible pathways to connect with each other. For example, the first pathway is that when people suffer from the diabetes, they may lead to the leukocyte adhesion and increased vascular permeability and cause lymphocyte aggression and finally lead to the periodontitis. The second linkage is periodontitis and CVD. There are two possible pathways to connect with each other. For example, the first pathway is that when people suffer from the periodontitis, the pathogens will lead to the vascular inflammation and then stimulate leukocytes and lead to the release of cytokines and finally lead to the CVD. Certainly, there will also have periodontitis have other linkages with other diseases. I have concluded the possible relationship between SELECTINS and periodontal pathogens in this table. Next, I will introduce the implication of SELECTINS in treatment in periodontal diseases and associated systemic diseases. There are a limited number of clinical trials involving SELECTINS as a therapeutic target. Nevertheless, studies have proven that periodontal therapy positively influences endothelium dependent function by altering selectins expression, giving the potential roles of selectin in periodontitis and associated systemic diseases. Selectins can be anticipated to present possible novel therapeutic targets for the treatment of this disease. In the last part, I will have a discussion of my project. Look at this picture. Periodontal diseases are among the highest prevalent public health problem worldwide. Periodontal diseases are closely associated with systemic inflammatory disorders, especially the development of diabetes and CVD. Selectins may act as a promising checkpoint and therapeutic target for periodontal diseases and periodontal associated systemic diseases. Further research in these areas is required to assist in developing selectin-based therapeutic strategies for the treatment of periodontal and systemic diseases. That's all. Thank you.